When using a cautery tool or electrosurgical device to treat a nosebleed, grounding is an essential safety measure. The cautery tool generates high-frequency electrical currents to coagulate blood vessels and stop bleeding. Here's why grounding is important and how it works. 1. Safety. The grounding pad provides a safe path for the electrical current to return to the ground, reducing the risk of electrical shock to the patient. If the current doesn't have a safe exit path, it could lead to burns or unintended damage to surrounding tissues. 2. Preventing burns. By grounding the patient, the cautery tool's electrical current is directed away from the surgical site and through the grounding pad. This minimizes the risk of burns to the patient at unintended sites. 3. Effective coagulation. Grounding helps ensure that the electrical energy is effectively used at the site of application, the bleeding vessel, allowing for accurate coagulation without excess energy dispersing into the surrounding tissue. 4. Proper functioning of equipment. The grounding pad helps maintain the electrical circuit's integrity, allowing the cautery tool to function properly and efficiently. In practice, the grounding pad is applied to a clean area of the patient's skin, typically away from the surgical site, ensuring that the electrical current can flow safely and effectively. The grounding pad used during cautery procedures works by providing a safe path for the electrical current to return to the ground through the patient's body. Here's how it functions and why it's placed on the patient's skin rather than directly on the ground. 1. Path of least resistance. When the cautery tool is activated, it generates a high-frequency electrical current. The grounding pad creates a low-resistance pathway for this current to travel back to the electrosurgical device and ultimately to the ground. The current moves through the patient's body because the grounded pad effectively connects the electrical circuit to the Earth's ground. 2. Placement on skin. The pad is placed on the skin rather than directly on the ground to ensure proper contact with the patient's body. Skin provides an effective surface for the electrical connection, allowing the current to flow back through the body in a controlled manner. If the pad were placed directly on the ground, it would not complete the circuit with the cautery device and would not function as intended. 3. Electrical circuit. The circuit is completed through the cautery tool, the patient's body, and the grounding pad. When the current flows, it goes from the cautery tool into the tissue, and any excess energy is directed back to the grounding pad, which carries it to the ground safely. 4. Safety and efficacy. Grounding through the patient's body helps prevent stray currents from causing unintended burns or injuries. Proper placement ensures that the electrical energy is effectively used for the intended purpose, e.g., coagulating the bleeding vessel, while minimizing risks. In summary, the grounding pad on the patient's lower back allows for a safe and effective return path for the electrical current, ensuring that the cautery tool operates correctly and safely during medical procedures. Yes, that's correct. Here's a more detailed breakdown of how the process works. 1. Current entry. When the cautery tool is activated, it generates high-frequency electrical currents that are directed into the tissue at the surgical site, e.g., a bleeding vessel. The cautery tool essentially serves as the source of the electrical current. 2. Current flow. As the current enters the body through the cautery tool, it flows through the tissue where the cautery is applied. This is where the electrical energy is used to coagulate blood vessels and stop bleeding. 3. Excess current path. If there is any excess electrical current, such as when the cautery tool is used or if there's a fault, the grounding pad provides a safe path for that excess current to travel. The current moves through the patient's body and exits through the grounding pad. 4. Return to ground. The grounding pad, which is in contact with the patient's skin, directs the excess current safely to the ground. This connection helps prevent unintended electrical discharge that could cause burns or other injuries. In summary, The electricity does indeed enter through the cautery tool, flows through the tissue, and any excess current is directed through the body to the grounding pad, which ultimately allows it to return safely to the ground. This process ensures the effectiveness of the cautery while maintaining patient safety. If there is no grounding pad used during a procedure with a cautery tool, several serious issues could arise. 1. Increased risk of burns. Without a grounding pad, there is no safe path for the electrical current to return. This can lead to unintended burns at the site of the cautery tool, as the energy may dissipate into the surrounding tissue instead of being directed away safely. 2. Electrical shock. The absence of a grounding pad increases the risk of electrical shock to the patient. The electrical current may find unpredictable paths through the body, potentially causing harm to organs or other tissues. 3. Ineffective coagulation. The cautery tool may not function as effectively without proper grounding. The lack of a return path can lead to erratic electrical behavior, making it difficult to achieve the desired coagulation effect on the bleeding vessel. Number 4. Equipment damage. The cautery device may also be at risk without a grounding pad. Uncontrolled electrical currents can cause damage to the equipment, leading to malfunction or failure. 5. Increased risk of fire. In some cases, excess electricity could lead to sparks or arcing, which poses a fire hazard, especially in environments where flammable materials are present. In summary, the absence of a grounding pad during cautery procedures can compromise patient safety, lead to ineffective treatment, and create a risk for both patients and medical equipment. Therefore, using a grounding pad is a critical safety measure in electrosurgical techniques.